While performing the general physical examination, after you have examined the hands, the next thing is that you have a closer look at the face. Sometimes you get a spot diagnosis by noticing the facial expressions or the facial appearance. Like you cannot forget a face if you have seen with a myxedema or a Cushing or a scleroderma. So along with the face, the next part of your observation is examining the head and neck area and eyes, ears, mouth. So today we'll be explaining what to look for when you are examining your patient's face and when you're examining his mouth and oral cavity. And collectively, this has been labeled as examining the head and eyes and nose, throat together is abbreviated as HEENT. So we'll start with examination of the head, then what to look in the eyes, then what should be observed while examining the ear, nose and throat, because many of the common illnesses which you see in your daily practice, they belong to this area, particularly if you are into family medicine or if you are into, say, general practice. Now, examining the head, the most common feature would be some loss of hair or some rashes or some say exfoliation. And now this is the first picture which you see is a picture showing depicting the seborrheic dermatitis. You may have loss of hair in patches in somewhere which is called as alopecia areata, and it is not uncommon to have, particularly the women, with the loss of hair or thinning of hair, which may be a manifestation of an underlying autoimmune disorder like systemic lupus erythematosus. It may be a manifestation of chemotherapy. It may be a nutritional deficiency. So observing all these features in the head and the hair is important. When examining the face, you start with the general look or general appearance or facial expression and appearance. You notice any rashes over the cheeks or forehead or over the face. You look at the eyes, both the external examination and examination of the conjunctiva, cornea, and the whole of the eye. You notice any peculiar appearance of the nose or any nasal obstruction, and linked to that are the parotid glands and ears. As I earlier said, there are few of the facial expressions or appearances which give you a spot diagnosis, and if you have seen it once, you cannot forget for whole of your life that this is how a face with myxedema or Cushing or scleroderma looks like. So one by one we'll be showing you the various facial appearances which give you a spot diagnosis. Now, look at this face. This lady has this dull appearance. There is fogginess of the eyes. There is loss of hair of the this eyebrows in the lateral parts. And if you talk to her, she not only that she has a facial expression, she is dull, her voice is hoarse, her speech is slow, and there is, as I said, lateral part of eyebrows have thinning or loss of hair. Eyelids are drooped and the eyes and the face become a bit puffy. Now this is almost a classical picture of a patient with myxedema or hypothyroidism. Next, uh, look at this person's face. He has, let's say, elongation of the face along with the tightening of the skin, not only over the face and forehead, but also over the hands and knuckles. Now this is if you notice his oral cavity, his mouth does not open to the full extent. So the short oral orifice, this is feature of systemic sclerosis. Notice the puckering of the skin around the uh, lips and oral orifice, and this is puckering of the mouth. Notice this nose, which is quite pointed and beak-like. notice the forehead, which has shiny and this tightened skin. Now, these beak, nose, puckering of the mouth, small oral cavity, or difficulty in opening mouth, and along with systemic symptoms like difficulty in swallowing or sclerodactyly or tightening the skin around the these hands can be a feature of systemic sclerosis or scleroderma. This classical moon-like face, moon faces, there is hirsutism or excessive growth of hair, particularly in women, and this the appearance of mustaches, which is our sign of hyperandrogenism. These may be features of classical Cushing syndrome, or this is called as a Cushingoid faces or moon-like faces. Many times you come across patient with puffy eyes. Now this look at the swelling, swollen eyes, eyelids, both upper and lower, and this puffiness around the eyes. This is another example. Now this is periorbital puffiness, can be accumulation of fluid in the subcutaneous soft tissues around the eyes, and this may be a manifestation of hypoproteinemia as a result of protein loss in the urine, like in nephrotic syndrome, or maybe other reasons for marked hypoproteinemia. But classically, this type of a facial appearance in patient with nephrotic syndrome who have glomerulonephritis leading on to marked significant protein loss in the urine. This appearance should not be confused with another similar appearance. Look at this person's eyes, which are not only say puffy and shows bogginess and swelling, but they're slightly reddened as well. Now, this is a classical example of angioneurotic edema. Sometimes there may be a confusion in differentiating between puffy face as a result of nephrotic syndrome or an angioneurotic edema. Now, the angioneurotic edema may appear unilaterally or bilaterally, may involve other part of the body as well, and sometimes it may be associated with slight itching or say numbness-like sensations. So this is the periorbital puffiness as a result of either nephrotic syndrome or maybe an angioneurotic edema. Next, you note down is the rash over the face. This person has marked flushing of his cheeks around the perinasal area and on the cheeks. Now, this has classically been associated with uh, mitral stenosis, fair skinned people with some CO2 sometime retention, as well as some say local changes produce this malar rash or malar flush in patient with mitral stenosis. Now, this lady appears to have, say, pigmentary rash over her cheeks, and this classically is called as melasma, usually post-pregnancy or a pregnancy-related, say, rash appears in some women, and sometimes it may persist even after delivery. Now, this is melasma. You cannot forget this butterfly rash, classical bridge of the nose and over the cheeks, and this has been associated with systemic lupus erythematosus. So this is a butterfly rash. And then you may have this unilateral, say reddish, purplish appearance over the face or one side of the face, which is as a result of port wine stain or may be associated with the, say, intracerebral pathologies or intracerebral hemorrhages. After an overall appearance of the face, you focus your attention on eyes, starting from the examination of the lids. Now, this lady is showing, say, yellowish, say, deposits over the medial part of the upper eyelids. Now, these are classical cholesterol deposits, are called as xanthelasmas, which may be associated with hyperdyslipidemia as well, or sometimes may be just a manifestation of local deposition. And this may appear not only over the eyelids, but may also be there over the palms or over the shins or lateral over the extensor surfaces of the arms. Now, this is xanthelasma, and finding xanthelasma may say necessitate to work up for a possible lipid disorders. Notice this person's very prominent eyes, which are with a wide gaze or stare. This is proptosis or acne ophthalmosis, which is a feature of thyrotoxicosis or a Graves' disease. Notice this eye, the left eye is showing a drooping or ptosis. Unilateral ptosis can be a manifestation of a third nerve palsy if it is associated with a dilated pupil as well, and it can be a manifestation of Horner syndrome where it will be a constricted pupil ptosis and loss of cerebrospinal reflex as well. Now, this is unilateral ptosis. Some people may have even bilateral ptosis. Look at the drooped eyelids from both sides from the upper lip, which may be because of a lower motor neuron palsy of facial nerve on the both sides. So this is what you look in the lids and when you are examining the eyes. Then you may have the stare that one eye is looking in an direction, not in the same direction as the other eye is looking at. This may be strabismus or a squint, or it may be a manifestation of an extraocular nerve palsy or intracranial neuropathies. So to differentiate, you have to perform certain, say, further, say, maneuvers or test, which will clarify that whether it's a nerve palsy or whether it is, say, congenital squint or strabismus. Moving further during the eye examination, starting from the lids and then to the prominence or the drooping of the lids, you invert the lower lid downwards and look at this person's conjunctiva, which is markedly pale. So severe anemia, the best manifest as conjunctival pallor or conjunctival whiteness. So this is pallor. When you notice this person's eyes, this has marked yellow discoloration of the sclera. So these are the eyes of a jaundiced patient. Look at this eye, which is diffusely red, and this is, say, marked redness of the eye, maybe some watering as well. This is conjunctivitis. Look at this eye, the redness and lacing appearance of the vessels which are dilated, and this, but the thing is that this redness falls short of this cornea, and there is a clear cut space or distance between the cornea and the redness. Now this is, and there is slightly raised prominent vessels as well. This is episcleritis, which can be a manifestation of underlying autoimmune disorders, may be associated with other, say, like rheumatoid arthritis or SLE or Sjogren syndrome. This eye is showing, say, redness in the scleral area, which is as a result of a subconjunctival hemorrhage. Now, subconjunctival hemorrhage can be as a result of a minor trauma to the eyeball. It may be as a result of excessive forceful vomiting, can be a manifestation of an underlying bleeding disorders or a patient being on anticoagulants as well. Look at this eye. What you notice is that there is a grayish or say whitish ring around all around the cornea. This is arcus sinalis. With the aging, there is a deposition of certain substances, but and this has been associated with, if it appears in a relatively younger age, in less than 40 or 50 years of age, then we call it as arcus juvenalis, and this has been associated with, say, coronary artery disease or hypercholesterolemia or occult coronary vessel disease. Notice this, say brownish ring or sometimes greenish ring around the eye. This is classical Kessler-Fleischer ring, which is associated with Wilson disease or is associated with copper abnormalities, copper depositions. How can you forget this pearly white, say, lens in this person's right eye? Now this is, of course, it's a pearly white, so it's a pearl like moti, motia, is the term we use for this in our part of the world, or we call it as cataract. Now, this is again quite obviously visible and should not be missed. Moving on from the eyes to the ears. The detailed ear examination is usually the domain of ENT or otolaryngal, say, experts, but a quick look by an horoscope into an external auditory canal can give you a lot of information of being presence of any discharge, presence of a boil, or presence of a fungus, or maybe wax only. And sometimes these simple things can be a reason for pain in the ear, or maybe a manifestation of decreased hearing acuity. So horoscopic examination of the eye, or just putting a torch and say examining the external auditory canal and meatus, would be very useful component of the examination of head and face area. Close to the this ear and just front of the tragus and below the pinna and around the upper part of the mandible is the parotid gland. So parotitis may have say manifestation unilaterally or bilaterally as in mumps, and this can be particularly important in patient with say in pediatric age group or in children. So this is parotitis or mumps. Appearance of a vesicular eruption over the ear can be a manifestation of herpes. This herpes may be localized, or more oftenly it is with the geniculate ganglion involvement, and if it is associated with this herpetic lesion eruption vesicle which has then crusted, and the patient also has a seventh nerve lower motor palsy, this is called as Ramsay-Hunt syndrome. Looking at the nose, first we have to have a little bit of say anatomy revised. You have two frontal sinuses above the both eyes over the forehead. Then you have the ethmoidal sinuses, just the medial part of the eyes, and the maxillary sinuses. Now, the sinusitis is a very common, say, presentation in patient with in family medicine or general practice, and having some idea of that these can be reason for a headache, for a fever, for nasal blockade, for difficulty in breathing. So paying attention to this may be very say useful and may avoid your patient from very extensive further workups. Of course, the someone with the running nose and redness of the say nose and sneezing is a manifestation of common cold and flu. Look at this person's the nasal septum is deviated to the left side, and unilateral nasal blockade or recurrent sinusitis can be as a result of deflected nasal septum. Look at this person's nose, there is a visible, say, swelling, not swelling like a polyp or say protection into the right nostrils. Now, this is nasal polyp, can be associated with not only nasal blockade, recurrent sinusitis, difficulty in breathing. Sometimes a simple maneuver like just holding, say, slightly cold this speculum or this tongue depressor in front of the two nostrils may give you an idea of that when person breathe in and out, there would be appearance of say this vapors or this say slight clouding. If nasal obstruction is there, it would not be there, and you can notice that the patient have a unilateral bilateral nasal obstruction. Going on to the lips, of course, the first thing is the bluish discoloration of the lips. Not on the lips, notice this person has the bluish discoloration of the nasal tip as well. Now, this can be as a result of cyanosis. Now, cyanosis, not only that it can involve the lips, but marked cyanosis would give you purplish appearance of the uh, tongue and other tissues as well. Lips can have, say, spontaneous painful or swelling of upper or lower lip. This, as we already mentioned, in cases of eyes, a unilateral or bilateral swelling, a sudden appearance of swelling of the eyes can be a manifestation of allergic manifestation or a hypersensitivity of the vessels to certain substances, which may lead on to swelling or vasodilatation resulting from angineurotic edema. So lips abnormalities, apart from being observing them for cyanosis, you may notice any swelling of the lips. Regarding cyanosis, it must be clarified that the person is suffering from a say central cyanosis or a peripheral cyanosis. Cyanosis would appear as a result of deoxygenated hemoglobin falling below, say, 5 gram per deciliters, and as a result of that, the central cyanosis usually is as a result of either poor, say, oxygenation in the lungs or mixture of, say, two circulations like the cardiac shunts, or as a result of, say, AV malformations in the lungs, or whereas the peripheral cyanosis as a result of a marked vasoconstriction from cold or poor circulation, and this vasoconstriction may be a compensatory manifestation for a heart failure. The differences in the two are that the mechanism in central cyanosis is poor oxygenation, in peripheral cyanosis it's vasoconstriction. The skin in patient with the central cyanosis would usually appear warm, whereas it would be cold in patient with the peripheral cyanosis or vasoconstriction. If you rewarm a cold limb, and if the bluish discoloration disappears, it confirms that the cyanosis is peripheral cyanosis, whereas it would not happen if it is a central cyanosis. And then there may be associated manifestations of heart or lung disease in patient with central cyanosis, whereas in peripheral cyanosis, of course, patient with advanced heart failure may show peripheral cyanosis as sort of marked vasoconstriction, but usually is as a result of exposure to cold. Then you just ask the patient to open the mouth and start observing from the lips and gums and teeth. You observe the palate, hard palate. You observe the uvula and its position. You notice the presence of palatine tonsils or presence of the tonsils in the pharynx, and of also notice the tongue, and not to forget that you notice the teeth, their number, count, appearance, any carious things, and any missing teeth. And then you start noticing again the lips. The lateral parts of the lips may show this crusting and say some roughening and some oozing of blood, which may be as a result of angular stomatitis. Now, angular stomatitis can be a manifestation not only of certain, say, deficiencies, this protein as well as vitamin deficiencies, and can be as a result of some local pathologies as well. This vesicular eruptions around the lips is an example of herpes labialis or herpes simplex. Can be a manifestation of an eruption as a result of lower immunity, or say whenever you have a bacterial infection, there is a secondary overgrowth as a result of say previously inactive say viruses becoming active in that part. Moving on to gum, this classical hypertrophy of the gums can be a manifestation of some drugs like phenytoin. It can be a manifestation of some hematological disorders or malignancies. Notice down the overall orodental hygiene, missing teeth, staining, nicotine staining, as well as carious teeth can give you a clue to a patient's, say, source of infection, in particular in patients with bacterial endocarditis, or wherever you don't find a cause for, say, septicemia or infection. The tongue, notice this tongue, which is normally the tongue is like a towel. There are papillae, there are furrowing, there is a lot of this ciliary appearance, but this is devoid of all those features. This is a bald tongue, and this bald tongue can be as a result of protein deficiency and vitamin deficiencies or iron deficiencies. The strawberry tongue, again, riboflavin deficiency and certain, say, uh, deficiencies like more of a pitted or puncted, say, tongue appearance. And then this beef-like fissuring of the tongue, again, can be as a result of certain protein deficiency. Sometimes it can be a normal appearance in some individual as well, but it usually is a manifestation of an underlying protein malnutrition deficiencies. Revising the anatomy of the throat is important. That we just saw just a cartoon, and now it's a real picture that you can identify starting from the front up: the hard palate, the soft palate, the uvula, the tonsil on the two sides, and the tongue. Now notice this person's markedly enlarged tonsils with some follicle appearance and the pus over there. This is follicular tonsillitis. Notice this person's tongue as well as palate covered with the crusting whitish curd-like material, or this is oral thrush or candidiasis, can be a manifestation of, say, immune deficiency. It usually appears in patient with maybe associated with HIV or associated with other immunodeficient states or prolonged steroid use. Now we have covered the different, say, appearances which you have to notice while examining your patient's head, face, and neck area. As I earlier said, that just a closer look at your patient's facial expression and facial appearance can give you a diagnosis. Sometimes not having looked at their, say, ear, nose, throat area, you may miss a clue towards, say, a localized infection, and you may be finding it here and there, going for a unnecessary investigation, and patient may be suffering from a simpler, say, just a pharyngitis or tonsillitis or otitis media, and may need a simple treatment. And at other times, this there can be manifestation of a systemic disease in oropharynx and in the throat or in the head and neck or face area. So from now, next we'll be covering for this neck, head and neck area, where you will be uh, learning what to look for in the neck, like in thyroid, lymph nodes, how to examine JVP. So watch for our next video, which would be on the third component of general physical examination. Thank you.